Did you know that more than 1/3 of people with diabetes have significant complications? Furthermore, they are still unaware of it. Sugar isn't the only factor in diabetes. It is a slow-moving, silent energy that can subtly harm your kidneys, heart, nerves, eyes, and even your brain without any outward indicators. Not to frighten you, but to wake you up, we're going into great detail about the top 6 conditions that every diabetic has to be aware of in this video. Why? Because harm is frequently overlooked in its early stages. Furthermore, the damage may already be irreparable or life-altering by the time symptoms show up. Don't turn away if you have diabetes or are taking care of someone who does. Your life, your mobility, and your health could all be saved by this. Before it's too late, let's find out what every diabetic should see. First, heart disease and stroke. Stroke and cardiovascular disease. These terms are not limited to medicine. Every day, persons with diabetes are secretly stalked by 2 of the most serious and rapidly approaching threats. Compared to people without diabetes, diabetics have a nearly 2-fold increased risk of dying from heart disease or stroke. Furthermore, a lot of people are unaware of it until it is much too late. However, why is this relationship so potent and lethal? In addition to harming neurons, persistently elevated blood sugar levels erode the artery's inner lining, which facilitates the accumulation of fatty plaques, stiffens the vessels, and obstructs blood flow to the heart and brain. This implies that a diabetic's risk of heart attack and stroke increases dramatically due to sustained high glucose alone, even in the absence of high cholesterol. Even worse, nerve degeneration obscures the typical warning indications of chest pain, so many diabetics are unable to experience them. Thus, a heart attack, often referred to as a silent killer, can occur suddenly. The American Heart Association reports that roughly 68% of diabetics over 65 pass away from heart disease and another 16% from stroke, which should raise serious concerns. Even more concerning is the fact that people with type 2 diabetes frequently have several risk factors, including insulin resistance, oxidative stress, obesity, inflammation, high triglycerides, and low HDL cholesterol. They all combine to hasten blood vessel aging and arterial damage. Not to mention that more than 70% of adults with diabetes have high blood pressure, which increases the risk of stroke, particularly when combined with renal problems or retinopathy. A single clot can cause a stroke, but it takes time for the clot to form. Years of inadequate control cause it to grow silently. Early symptoms like minor chest tightness, regular weariness, occasional dizziness, leg cramps, or edema are frequently written off as indicators of aging or overexertion, although most people expect catastrophic symptoms. However, there may already be significant vascular problems at play beneath those symptoms. Men's erectile dysfunction is one often ignored warning symptom of clogged arteries. Frequent midnight urine is another, which may indicate heart stress in addition to renal abnormalities. Diabetics frequently just pay attention to blood sugar levels, failing to realize that each surge in glucose causes blood vessels to become inflamed, brittle, leaky, and more likely to burst or clot. Diabetes and heart health are therefore essential. It's necessary. Although they can detect early alterations, routine ECGs, echocardiograms, carotid ultrasounds, and ankle brachial index tests are rarely performed unless symptoms are quite severe. Understanding your lipid profile, blood pressure, HbA1c, and inflammation indicators like CRP is the first step in prevention. Blood sugar control is not sufficient on its own. Regular mild exercise is necessary to strengthen the heart muscle, support your vessels, and lessen oxidative damage. A daily vigorous walk of even 30 minutes can reduce heart-related problems by as much as 35%. Additionally, reducing extra weight by merely 5 to 10% can reduce cardiovascular risk by almost 20%. Magnesium-rich meals, potassium from leafy greens, antioxidants from berries, and heart-healthy fats like omega-3s all promote nerve and arterial health. Diabetic neuropathy comes in second. One of the most overlooked but deadly consequences that every diabetic should be aware of is diabetic neuropathy, the silent killer of the kidneys. Complete kidney failure can develop from a barely perceptible protein leak in your urine. The worst part is that even when your kidneys are slowly withering, you could feel perfectly great. Kidney disease affects 1 in 3 persons with diabetes in the United States alone. Additionally, it is currently the leading cause of end-stage renal disease, which puts people on dialysis or transplant waiting lists. However, what really is taking place within your body? Over time, high blood sugar damages your kidneys' glomeruli, which are microscopic filtering units. This causes the glomeruli to enlarge, scar, and lose their capacity to filter waste. This harm isn't arbitrary. Unless detected early, it is gradual, deliberate, and irreversible. When albumin protein begins to seep into the urine, the filters are malfunctioning. Ignoring it will also cause renal failure without you even recognizing it. Why is this so risky? Because it's frequently too late by the time you notice symptoms like swollen feet, puffy eyes, frothy urine, or extreme fatigue. It is possible that over 70% of renal function has already been lost. Don't be duped, either. It's not just sugar here. Uncontrolled blood pressure, insulin resistance, and even certain medications silently speed up the destruction. Undiagnosed hypertension, which functions as a hydraulic hammer and beats your already damaged kidneys until they give out, is actually present in more than 60% of diabetics with kidney impairment. Diabetic neuropathy is particularly lethal because, even before dialysis is involved, it increases the risk of heart failure, stroke, and sudden death. When renal function falls below 15%, the typical lifespan for someone bound to dialysis machines is only 5 years, and frequently fewer if heart disease is present. What can you do, then, to avoid being caught? Urine microalbumin is a test that is often disregarded but can save lives since it can identify renal stress years before symptoms show up. Since their blood sugar levels are normal, many diabetics ignore it. Here's the twist, though. Nephropathy can occur in diabetics with stable A1C values for a variety of reasons, including heredity, chronic diabetes, or excessive use of medications that silently strain renal function, such as naproxen or ibuprofen. The good news is that, when taken consistently, certain blood pressure medications, such as ACE inhibitors and ARBs, not only lower blood pressure but also protect the kidneys from additional damage. Kidney collapse can be discreetly accelerated by missing doses or avoiding these medications out of concern for negative effects. The majority of diabetics are unaware of this. Your body can no longer effectively eliminate prescriptions when kidney function deteriorates, converting even life-saving pharmaceuticals into poisons. In people with extensive renal disease, even popular diabetes medications like metformin can become harmful and cause lactic acidosis. Regular monitoring is therefore required. Urine ACR, eGFR, and serum creatinine tests must be ordered on a monthly basis rather than annually. Diet is also very important. Even when sugar levels are under control, diets heavy in salt, potassium, phosphorus, or animal protein might subtly exacerbate renal disease as the kidneys deteriorate. However, many people inadvertently consume these items on a daily basis because they think they're harmless. Imagine maintaining optimal blood sugar levels but nevertheless losing your kidneys as a result of an unmonitored diet or missed laboratory tests. Diabetic neuropathy is number 3. The most common yet little understood danger that lurks behind high blood sugar is diabetic neuropathy, a nerve-damaging illness that most diabetics are unaware of until it is too late. In the United States, more than half of diabetics currently have some kind of nerve damage. Surprisingly, many people are unaware. Why? Because it's not always obvious that this illness needs attention. It begins with a slight burning sensation in your legs at night, a weird tingling sensation in your feet, or a slight numbness in your toes. Many people ignore the symptoms until they become intolerable. And by then, you may have irreversible nerve damage. Here's what makes diabetic neuropathy particularly harmful, though. It affects more than just your emotional intelligence. It can cause debilitating discomfort, weaken your muscles, impair your balance, and even interfere with your heart's, stomach's, and bladder's natural processes. It's not only discomfort here. One nerve at a time, this is about losing your independence. The majority of people are unaware of how badly sugar affects nerves. When blood flow to the sensitive nerve fibers is cut off by persistently elevated glucose levels, inflammation, oxidative stress, and demyelination, the removal of the protective sheath around nerves occur. When it occurs, nerves malfunction. Some quit functioning, while others give off illogical pain signals. This explains why some diabetics feel nothing at all, even when they walk on a nail or get a bad foot ulcer, while others suffer from intense agony from a light bedsheet. The worst part is still to come. Neuropathy precedes more than 80% of diabetic amputations in the United States. You might lose your foot tomorrow as a result of the nerve damage you choose to ignore now. However, it doesn't end there. The less obvious kind, autonomic neuropathy, can cause your heart to beat too quickly or too slowly, cause your blood pressure to suddenly drop, and even paralysis your stomach, which can result in gastroparesis, a condition where food rots in your stomach because the nerves are unable to transfer it. Even more concerning is the fact that diabetic neuropathy significantly increases your chance of falls, fractures, and even silent heart attacks because your brain may not receive pain signals when anything is amiss. And although the connection to stroke is real, it is rarely discussed. Diabetes-related long-term nerve damage frequently coexists with blood vessel damage, raising your risk of hemorrhagic or ischemic stroke, particularly if your blood pressure or cholesterol are both out of control. Because nerves are involved in heart rhythm and vascular regulation, diabetics with neuropathy have twice the risk of stroke and cardiovascular death, according to studies. It's not only about feet, then. Your entire nervous system is under attack. Behind the scenes, your touch, digestion, breathing, and heartbeat are all gradually coming apart. This is when things become more worrisome. Particularly in older persons, the process is frequently silent. Many people don't experience any symptoms until permanent loss has already occurred. Early indicators can be found with straightforward procedures such as nerve conduction studies, vibration sensitivity using a tuning fork, or the monofilament exam. Many diabetics, however, are never given them until the harm is severe. Once nerves are damaged, there is no recovery. However, symptoms can be controlled and nerve function preserved if detected early. Although strict blood sugar management is necessary, it is not the only answer. A hidden cause of neuropathy that exacerbates symptoms, particularly in older adults, is vitamin B12 insufficiency, which is frequently brought on by using metformin. Pregabalin and gabapentin are examples of painkillers that may reduce pain, but they do not prevent nerve loss. Therefore, the only effective defense is a multi-step regimen that includes lifestyle modifications, frequent screenings, foot inspections, nerve protective foods, and blood glucose control. It's time to pay attention if you have diabetes and have been ignoring symptoms like numb feet, tingling toes, wobbly balance, or bloating in your stomach. These age-related problems are not arbitrary. They are cautions. Diabetic neuropathy steals things without warning. Additionally, you might be too late to take action if you wait for it to make a big announcement. Permission is not requested for this condition. It ruthlessly and secretly gets what it wants. However, you may prevent it from taking more if you are conscious of it and take action. Diabetic retinopathy is number 4. For any diabetic, diabetic retinopathy is one of the most concerning risks that lurks in plain sight. The startling fact is that almost 1 in 3 Americans already has diabetes, frequently without realizing it. The retina, the area of your eye that gives you vision, has small blood vessels that are silently harmed by this disorder. However, the risk of blindness is not the only thing that makes it genuinely harmful. It's how it alerts us to the fact that your entire circulatory system is being attacked. The retina is deprived of oxygen when blood sugar levels remain elevated for an extended period of time, causing the fragile veins in the back of your eye to leak fluid, bleed, or shut off completely. The body grows new, aberrant vessels over time in an attempt to correct this, but they are feeble and prone to bleeding. The actual loss of vision starts here. Imagine discovering complete blackness, hazy borders, or black areas when you wake up one morning. It is not uncommon. That's true. And that might be irreversible. Diabetic retinopathy affects more than just the eyes, as most diabetics are unaware. It is an indication of a stroke. Your brain most certainly has the same vascular damage that is occurring in your retina. Studies have shown that the risk of stroke is up to 3 times higher for diabetics with severe retinopathy. Why? Because your vascular health can be seen through the retina. The arteries that supply your brain, heart, and kidneys are probably also leaking, narrowing, or irritated if the blood vessels in your eyes are deteriorating. Indeed, it is currently thought that diabetes retinopathy can foretell silent brain infarcts. Small strokes that gradually erode your brain health without causing any symptoms. This is where the twist lies. Damage may already be in its early stages even if your eyesight appears to be good. Because it is painless and silent in its early stages, this illness is very deadly. The vessels won't feel like they're leaking. When your retina starts to enlarge, you won't notice it. Annual dilated eye exams are therefore essential. By the time you notice symptoms like blurred vision, floating spots, or trouble seeing at night, the damage may already be advanced, even if your eyesight feels normal. Progression can be slowed or stopped by therapies such as laser therapy, anti-VEGF injections, and in extreme situations, vitrectomy operations. However, prevention is essential. Keeping your blood pressure below 130/80, your LDL cholesterol under control, and your HbA1c below 7% all lower your chance of advancement. Additionally, don't ignore the impacts of medications. Poor management of hypertension or prolonged steroid usage can hasten ocular vascular damage. So why is diabetic retinopathy important to all diabetics? Because safeguarding your complete vascular system is more important than just preserving your vision. The retina is alerting you to more than just visual loss when it sends out a distress signal. It's warning you that your brain could be the next. And blurred vision might not be the following symptom if we ignore that indication. It could be a stroke you didn't anticipate. 5. Diabetic foot infections and ulceration. Although diabetic foot ulcers and infections can seem like small problems, they are among the most serious and potentially fatal consequences of diabetes. Surprisingly, more than 15% of Americans with diabetes will experience a foot ulcer at some point in their lives. A minor blister or invisible cut can develop into a severe, infected infection that takes months to heal. Why? Because excessive blood sugar impairs blood vessels and neurons, decreasing pain perception and preventing healthy blood flow. Because peripheral neuropathy is a silent numbness that prevents the warning signals from being detected, many diabetics are unaware that they have hurt their foot. The sore can already be septic or gangrenous by the time they detect it. The actual danger begins at that point. Diabetics' immune systems are compromised. Because 1 in 5 diabetic foot ulcers result in amputation, even minor infections can quickly worsen into major cellulitis, abscesses, or bone infections. However, the majority are unaware of this. There is a clear correlation between foot ulcers and an increased risk of stroke. It may come as a surprise, but research now indicates that diabetics who have chronic foot sores are at an increased risk of ischemic strokes because of systemic inflammation and vascular damage occurring throughout the body. The infection spreads outside the local area. In addition to generating clotting abnormalities, artery narrowing, and blood pressure spikes, it dangerously triggers the immune system, creating the ideal environment for stroke. Additionally, because these ulcers progress slowly and are frequently left untreated until they become serious, the inflammation can linger for weeks or months, subtly impairing the blood flow to the brain. Diabetic foot ulcers are more than just skin issues. It's an indication that your circulatory system as a whole is stressed and not able to recover appropriately. Those with poor blood sugar management are at significantly higher risk. An HbA1c above 8% slows healing and dramatically promotes ulcer recurrence. Smoking, poor kidney function, and elevated triglycerides all increase the risk of infection. And bodily harm is just one aspect of it. Depression, decreased mobility, social isolation, and rapidly rising medical expenses are all consequences of having chronic foot sores. A vicious circle exists. Insufficient mobility raises insulin resistance, lowers circulation, and causes further problems. Antibiotics, unloading devices, debridement, and even surgery are essential treatments. However, early prevention is even more crucial. It is necessary to inspect your feet every day, wear appropriate shoes, treat cuts right away, and see a podiatrist on a regular basis. These are practices that can save lives. Because one undiagnosed wound in diabetes might result in more than simply the loss of a leg. You might not anticipate it, yet it might subtly prepare the way for a fatal stroke. The sixth state is hyperosmolar hypoglycemia. Despite being one of the least discussed diabetic emergencies, hyperosmolar hypoglycemia is one of the deadliest, particularly for older persons with type 2 diabetes. HHS strikes silently and swiftly, which is what makes it so dangerous. In contrast to diabetic ketoacidosis, HHS does not manifest with acidosis or ketones. Therefore, most people are unaware that their blood sugar is out of control until they pass out. Blood glucose levels in this disease can rise to beyond 600 mg per deciliter, which can cause severe dehydration, seizures, altered consciousness, or even coma. However, nobody discusses this section. Because HHS is frequently discovered too late, more than 10 to 20% of people pass away, not because the condition is incurable. Fluid loss is the main risk. When glucose levels rise, the kidneys have to work extra hard to remove the sugar, which results in excessive urine and a daily fluid loss of up to 10 electrolytes. Sodium and potassium are also lost. Water is drawn out of brain and muscle cells as a result of the hyperosmolar environment that is created, resulting in stroke-like disorientation, weakness, blurred vision, or speech problems. Since they are not in ketoacidosis and do not exhibit the characteristic fruity breath or nausea associated with DKA, many patients receive incorrect diagnoses or have delays in therapy. Because of this, all diabetics, but the elderly in particular, should be alert of symptoms such as inexplicable exhaustion, extreme thirst, dry mouth, fast heartbeat, and mental haze, particularly during hot weather, illnesses, or after skipping insulin. It takes time for HHS to emerge. It frequently occurs after days of inadequate glucose management, forgotten prescriptions, silent diseases like pneumonia or urinary tract infections, or even emotional stress. Additionally, in individuals with dementia or living alone, it may worsen undetected until they are discovered comatose or confused. Because HHS results in thicker, sluggish blood, the association with stroke is frightening. It dramatically increases the chance of brain enlargement, which is frequently irreversible, or ischemic stroke. The risk becomes evident when you include the electrolyte imbalance, which can cause irregular heartbeats and cardiac arrest. The worrying thing is that blood sugar monitoring, adequate education, and water can totally prevent this illness. Elderly people should never go without food, medicine, or drink, especially while they are ill. Early symptom detection and prompt action can mean the difference between recovery and disaster. Mobility, memory, independence, and even life itself can be taken by HHS, even if it may go undetected. Since raising awareness is the first step to halting diabetic damage in its tracks, if you've read this far, you're already ahead of most people. It's time to take action, though. Check your symptoms, consult your physician, and share this video with someone who needs to hear it instead of simply watching. Your ability to safeguard your heart, kidneys, eyes, nerves, and future increases with knowledge. To ensure you don't miss any important updates, please hit the like button. Subscribe for more life-saving health insights, and turn on the bell if you found this useful. This is prevention, not only information. Remain with us on Health Angel Solutions, remain strong, and stay smart.